you must use Technigas. People who are using other agents, like xenon, for example, it's a mistake. It's not state of the art. And you cannot do that to your patient, because the patient, you have to offer what is best technically, but also the product you are using. So, and the way now, it's almost impossible to miss a pulmonary embolism now. If you use the Technigas and if you use also the spec, you cannot use planner. We don't use it anymore, and it's not state of the art. And the other thing is, if you detect a pulmonary embolism on a patient, you must do not later than 3 months a new study, because a lot of those patients, they will have another pulmonary embolism, and in many cases, it will be in the same area. So if you have not done this basic study after you detect a pulmonary embolism, you could get in trouble, and the patient is... The other thing is, the specialists who make the report must he must be binary. He must decide if there is an embolism, yes or no. Probability, it's a mistake. And this is the reason for, in many countries, a lot of them, they have switched to other technique like CT. But CT gives you a lot of radiation, and even a young lady, they should not do a CT because they give too much radiation to the breast. People who still stick to planar image, they miss some small pulmonary embolism. We will have to quantitate. We will have, in very next future, all study that we will do with SPEC and with Technigas also, we will have to give numbers. We will have to quantitate. So, you know, like in minors, they have a problem with their lungs. Old people also with emphysema. Then we will, and we also, if you want to do some surgery, before, suppose you have a cancerous lesion, you have to evaluate what is the reserve of the rest of the lungs. So a lot of application. It's like, it will be like doing, if you cannot think of doing a kidney study without numbers, yes. While it will be the same thing in the lungs, and it will bring a lot of information, very useful. So instead of doing spirometry, you will use nuclear medicine. The Technigas is really state of the art, and it's an obligation for the nuclear medicine specialist to use this technique.